Welcome to the MamasteFit YouTube channel. If you've been having left SI joint pain, I'm going to break down what are the causes of this pain, plus some exercises that you can do to find relief from back pelvic pain. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula and mom of four. And SI joint pain is something that I dealt with during my pregnancies, and so I am well versed what you can do to resolve this type of discomfort. But first, let's understand the SI joint, its function, and what may be contributing towards that left-sided SI joint pain. And now, if you have more right-sided SI joint pain, check out our video from last week where we break down what causes right-side SI joint pain. Your SI joints are located on the back side of your pelvis. So we have our sacrum here, your pelvic halves on each side, and the junction between those two are your sacroiliac joints, more commonly known as your SI joints. The SI joints are where a lot of movement is happening through, and so we're transferring load from our upper body through the SI joints into our lower body. And now, there's not a ton of movement that happens in this joint, and so the movements that I demonstrate for you in this video are going to be a little bit more exaggerated so that you can see what is actually happening. But there is movement that does occur at this joint because this is a joint that requires a lot of force distribution. For a lot of us, we tend to favor our weight more into the right leg, and it creates this left AIC pattern where the left pelvic half sits a little bit more forward and compared to the right pelvic half. Because of this, we have a little bit more external hip rotation with abduction on the left side, in addition to it's slightly more tilted forward in an anterior tilt. While on the right side, we tend to favor a more internally rotated position with adduction and a slightly more tucked position or a posterior pelvic tilt. So this normal asymmetry of our pelvis is not always an issue. It's just the normal way that we stand. We have denser organs on the right side. The diaphragm is larger on the right side. So it's more comfortable and stable for us to put more weight into the right. However, there can become a problem when we can't shift our weight properly over to the left and find that internally rotated position on the left side. And so if you are having a hard time finding more of that internal rotation on the left, this can cause that SI joint pain. So if you're always stuck in this forward hip position, there's a little bit more gapping that happens to the front half of your SI joint where your sacrum and your pelvic half meet. And so because of that gapping, this can impact the form closure of your pelvic joint. Form closure is how your pelvic joints fit together like a puzzle piece, while force closure is how well do the muscles supporting the SI joints and your pelvic joints help to compress them together. And so if the puzzle pieces are not quite fitting well together, this can cause that SI joint pain more towards the left. So in this workout, we're going to break down exercises that you can do to help improve finding that internal rotation on the left side to bring your weight properly over to the left hip. We'll start with a 7-minute warm-up just to loosen up and then get familiar with bringing your weight over to the left side. And then we're going to move on to a strengthening workout to help support that force closure around that pelvic joint. And if you like workouts like this, be sure to subscribe to our channel because we release new workouts every Tuesday to help support you during your pregnancy and preparation for your birth and to feel more comfortable in your motherhood journey. And as always, you can check out any of our online fitness programs, both for pregnancy and for the postpartum, plus our pelvic stability program if you're looking specifically for exercises to help you feel more comfortable here, all on our website at MamasteFit.com. And you can use our code YouTube10 to get 10% off any of our online offerings. So all you'll need for today's warm-up is a yoga block. We'll move through the warm-up and then I'll walk you through the strength portion of today's workout. We're going to start with an all-fours hip shift. So place one knee onto the yoga block and then we're going to shift our weight over to that elevated knee. From here, I'm going to move through some pelvic tilts. Think about keeping like 80% of my weight in this elevated hip so I don't have a ton of weight in my lower leg. So drop the belly to the floor and then exhale to round in the back as you bring baby and belly to the spine. Inhale to lower down. Exhale, pull belly to spine to round. So you're going to be feeling a lot of stretch here in this elevated hip pocket. And then make sure that hip is shifted over. If you're still over towards the lower hip, you're not going to feel that much in that elevated leg. So shifting the weight over, move through your pelvic tilts. Inhale, belly to the floor. Exhale to round. Now drop the belly to the floor, exhale, round, and then reach up to the ceiling with that same side arm. Bring that hand down, drop belly to the floor, round, and then reach up. And then again, keep thinking about keeping weight in that elevated hip. So we're finding the expansion and then coming back down. So we're adding in thoracic rotation to our pelvic tilts front to back. We got 30 more seconds here, and then we'll switch to do the other side. And then we're going to come up to a standing position. One of the things that's really helpful to helping you bring your weight over to the left leg is to find hip shifted positions. Hip shifts are bringing that hip into a closed position, which is that internally rotated position with adduction. And that is how we stabilize in our hips. Let's go ahead and switch to the other side now. So place that block under your other knee. And I want you to think first, shift your weight over to that elevated hip. So you should already feel a little bit of a stretch in that back hip pocket. Inhale, drop belly to floor. Exhale to Ryan, pull belly to spine. And we're thinking about keeping almost all of our weight over that elevated hip. So I would say like 80% of your weight is on that elevated knee. Drop belly to the floor and exhale to round. Learning how to hip shift is crucial for pelvic stability, especially if you're having more of that left SI joint type pain. If you can learn how to shift your weight properly over to the left side, it will really relieve a lot of discomfort that you may be feeling. So if you're having more tailbone pain, maybe more SI joint pain, lower back pain, sciatic pain, all of these things can be resolved by just learning how to hip shift. Five seconds, we'll add in that rotation. So drop belly to floor, exhale, round, and then reach up to the ceiling, and then come back down. So we want to find the rotation with a rounded back. Typically, you can twist and rotate better in a rounded position. And yes, if it's not clear by now, you should absolutely be twisting in your spine, even during pregnancy. If you don't twist in your spine, you'll probably find that you're more uncomfortable. If you don't have twists within your pelvis, you're going to have more pelvic pain. Making sure that we're keeping that weight still in that elevated knee, even when we sit up to rotate. After this, we're going to move to a standing position to explore the hip shift in an upright position. So go ahead and come to a standing position. We're going to start by placing the left foot on your yoga block. I'm going to put more weight into that left foot, and then I'm going to hinge my hips back. You'll have a little bit of a bend in that left leg, but again, more weight is in that left leg than the foot down on the floor. And then bend in the right leg as you bring that right hip forward. Think belly comes more towards that thigh. So we're here, belly comes towards the thigh. Now starting at the foot, I've got lots of weight in that big toe. This knee is rotating in. Belly is more towards that thigh, and you're feeling a really big stretch through this glute area. If you feel a lot of hamstring, just bend in that knee a little bit. But we're really thinking, I'm trying to take my pelvis and rotate it on top of that femur head without my leg flailing out to the side. So lots of weight in that big toe, knees kind of rotating in, belly towards that thigh, trying to seek this big stretch here. And you may have to explore it. Spend some time kind of shifting your weight around. Think slight round in that low back. And then pay attention. It should be a similar sensation to the all fours, but maybe a little bit more intense. So let's find it on the other side now. So I'm going to place my right foot onto the block. I'm going to hinge my hips back just slightly. I have a little bit of a bend in my right leg. I'm going to put more weight into that right foot and then drive the left knee forward as I bring that left hip forward. So belly comes more towards the thigh. I'm feeling more of a stretch in the right glute. I think lots of weight in that right big toe. Knee kind of rotates in just slightly. And if you need, slight tuck underneath. Similar to the all fours hip shift, the standing hip shift, most of the weight is in my standing leg or my elevated leg. I'm trying to feel this big stretch in this glute, so you might just kind of have to play around with it. Can you shift a little bit more here? Maybe you adjust like slightly where the weight is distributed. But just pay attention to that sensation. We should be feeling a little bit more of a stretch kind of in this back hip pocket area. Maybe a little bit stretched through the leg. If it feels too intense, just bend in that knee. Go ahead and release. So this concludes our warm-up. Hopefully you feel a little bit more familiar with what a hip shift feels like. We're going to go ahead and reinforce the things that we learned in the actual workout. So we'll see you in the workouts. Let's move on to the strength portion of today's pelvic stability workout. This workout is from our pelvic stability program, which is going to be the beginner workout of our 3-part progression. Within the pelvic stability program, we have a beginner workout, a novice, and then advanced of the same general exercises with different variations. So we have our basic variations, our moderate, and then our advanced variations. And so today's is going to be the beginning one. And so if you want more of the progressions, be sure to check out the pelvic stability program. For today's pelvic stability workout, we're going to need a band that's attached around eye to chest level for the half kneeling archer rows. If you don't want to use a banded attachment, you can just use your hand as an anchor to do your rows from. So the opposite hand will hold it, and then you'll row with your moving hand. In addition, you can use a yoga block if you like, but it is optional, and then you may want a light to medium weight for the lateral hip shifts, but those are also going to be optional as well. So once you've got your equipment, let's go ahead and get started with today's strength workout, where we'll be doing 2 rounds through our beginning pelvic stability exercises. So let's go ahead and grab onto our band and come into a half kneeling position. We're going to start with the right knee forward, and we're holding the band in the right hand. With this workout, we're going to move through 2 rounds. You can either do just 1, you can do 2. If you want to do more, just repeat the workout video. So holding onto the band in my right hand, I'm going to think open up in my chest, and then exhale to row as I try to bring this elbow to like my hip. So inhale to reach forward to open, and then exhale to row to bring the elbow to the hip. And then I want you to think about your leg. So that right foot is pressing hard into the floor. That right knee is staying generally stacked over that ankle. So as you move your upper body, that right knee is not flailing from side to side. It's maintaining its position. Exhale, row, elbow to the hip, and then almost think like the belly is moving a little bit to that right thigh. So we have rib cage movement, we have some pelvic movement, but that lower leg is maintaining its position. Let's go ahead and switch sides to right knee down, left foot is forward. Hold the band in that right or that left hand, and we're going to start in this open position. Exhale to row, then bring that elbow to the left hip, and then inhale to reach forward. And then same thing, we're thinking lots of weight in that left foot. The left knee is staying generally stacked over the ankle. And then as you row and come back, the belly moves a little bit more towards that left hip. So this is like a supported way to start to load that left hip and to have everything kind of moving towards that hip shifted position. Go ahead and release that band, and let's come to a standing position. So we're going to do that same hip shift that we did in the warm-up, but we're going to have the feet on the same level. If you want to use the yoga block, you can use the yoga block as well. So we'll start with that left leg. I'm going to put more weight into my left foot so I can lift my right foot off the floor. You're going to step that right foot forward just a little bit. I'm going to hinge my hips back and then bend and drive my right knee forward to bring my belly more towards that left thigh. And again, more of the weight is in that left hip. I could lift the right foot up and somewhat maintain my position. So lots of weight in that left big toe, left knee is kind of rotating in just a little. And I'm really thinking about like shifting my weight kind of diagonally back into this left hip. Belly comes more towards that thigh, keeping lots of weight in that left big toe. And then you're getting just like slight tuck underneath of that pelvis. Just kind of keep checking in. Lots of weight in the left big toe. Belly's coming a little bit more towards that thigh. And then just pay attention to the sensation that you feel here. How does it feel in kind of the lower back glute area? Again, if you're feeling a lot in the hamstring, you might have that leg too straight. Bend in that knee just a tad. So let's go ahead and find it on the right side. So step the left foot forward. I'm going to hinge my hips back. And then I'm going to drive the left knee forward to bring belly towards that right thigh. Lots of weight in that right big toe. Right knee kind of twist in just a little. Got a slight tuck underneath of that butt. And then really think about lots of weight in the right big toe. Slight tuck. And then just kind of keep checking in up and down the chain. So we got the big toe, knees in, belly to thigh, slight tuck. The next progression to this exercise is going to be to add some movement, and then we can even add shifting from side to side, which will be our advanced variation. But for today, we're just focusing on can we find this position in a stationary position to sink into it to feel the stretch and release happening in the back half of that pelvic floor. Let's go ahead and come out of it. And now we're going to move into some lateral hip shifts. So we're going to be shifting our weight to one side, kind of coming in and out of it. And then we're going to shift our weight to the other side. So we'll start with feet just a little bit wider than hip distance. We're going to start by hinging forward at the hip. So just like maybe like halfway between all the way up and parallel to the floor. And I'm going to shift my weight over towards the left leg. We'll start there. Belly comes to the thigh, and I'm kind of reaching for that foot. And then come back to stand, and then come back into that left hip. So we're going forward and backwards, just focusing on coming to one side. And then the next minute, we'll focus on going to the right side. So as I come back, foot and ankle and knee come into a straight line. Belly comes to the thigh, and then come back up. Everything gets stacked. Come back up. So looking to find that same kind of stretching sensation in the glute as we shift over to the left foot. If you want to add a little bit more, also think about weight in the right big toe. So we have kind of even weight in the two big toes. This is going to help bring you a little bit into that right inner thigh. In round number 2, if you want to add a weight to this exercise to help you move a little bit deeper into it, that option is available to you. So let's switch to the other side now. So we're coming over to the right. Same thing, ankle, knee, generally aligned. Belly comes towards the thigh. So we're reaching, twisting in the upper body for that right foot, and then come back up to center. So we're sinking here, and then come back to center. And then again, if we want to advance that a little bit more, think weight in both big toes. So left and right big toe. This is going to bring you a little bit into that left inner thigh. Next round, if we want to add a weight, feel free. After this exercise, we're going to move to the floor to begin to use the ground to aid us in finding that rotation in the pelvis. So we're going to come into a side lying position with the right hip down on the floor. Let's go ahead and come to the floor. You got about 30 seconds to get there. So we're going to start in this side lying position. Legs are going to be stacked with one another, and I'm going to think rib cage is fairly stacked with itself, so I'm not sagging here. With that top hand, I'm going to reach forward to kind of just above my face, and then I'm going to come back. And as I do that, my top leg is going to be shifting forward and then coming back to a stack. So we're going to reach forward and then come back. Here I'm almost thinking like belly is coming towards the floor or chest is to the floor and then back. So we're adding a little bit of a hip shift in this more supported position. Over the weeks, this will advance to where the hips come off the floor. But for now, we're just first learning the upper body movement and then trying to sync that to how the lower body is moving. So as you come forward, that belly is coming more towards that bottom thigh as you reach. So we're using the ground to kind of keep us in that position with the leg. Let's go ahead and switch to the other side. You got about 20 seconds to switch. So left hip is down now. And again, for most of us, left side's a little bit harder to do. So knees are stacked. We're going to be in a somewhat stacked position with the rib cage. Right arm is going to go ahead and reach to try to come closer to the floor. That right knee is going to come forward. And then we're going to come back. So right hip comes forward as you reach for in front of you, and then come back. So you don't really have to think too much about the hips. They'll just kind of move as you reach with the upper body. And as you reach, you may feel a little bit more of a stretch in that bottom glute as the belly comes more towards the thigh. And then if you want to add more intention to it, you can actively think, drive that right knee forward, and then drive it back. Drive that right knee forward, and then drive it back. After this, we're going to come back to that half kneeling position for the archer row. Let's come into that half kneeling position, grab onto your band. We'll start with the right side. So now we've gone through 4 exercises to help you learn how to rotate your pelvis with the upper body rotation. So we're going ahead and reach forward with that right hand, find an open position. Exhale, row, bring that elbow towards your hip and inhale to come forward. Exhale, row, inhale to come forward. As you row, think lots of weight in that right foot, knee is stacked, and then come back. And then maybe you feel the belly kind of rotate towards the right thigh a little bit more, which is going to bring you a little bit deeper into that right hip. You may feel a little bit more in that right groin area too. Keep lots of weight in that right foot. Keep that right knee stacked so it's not flailing in or out. Let's go ahead and switch sides. Right knee is down, left foot is forward. Start in that open hip position. And same thing, weight is in that left foot, left knee is stacked as everything else is moving on top of it. Exhale, row, bring elbow to the hip. Inhale, reach forward. Keep lots of weight in that left foot. Left knee stays stacked. And then we roll to think, bring that elbow to the left hip. Let's come to that standing hip shift. So go ahead and release that band, and we're going to come to that standing position. We're going to start with the left foot. Right foot is going to step forward. And so that left foot is my target leg. We're going to think first, let's hinge those hips back. I'm going to think drive that right knee forward. So I'm going to bend more in it, which is already going to kind of shift my hips. And then make sure there's lots of weight in that left hip. So right hip is forward. Belly's more towards that thigh. Lots of weight in that left leg. So like 80% of the weight. Start at the foot. Think lots of weight in that big toe. Knee slightly rotating in. Belly more towards that thigh. And then slight tuck underneath. So we're trying to feel a lot of stretching sensation here deep in the glute. If you want, you can add the upper body reach. We're reaching kind of in front to the side of that left foot. Sometimes I find adding in the reach helps me make sure that I'm twisting in the upper body towards that thigh. And then just spend time here, explore it. In the following workouts, we're going to add more movement here. So you learn how to shift it during movement, such as when you're walking. Let's switch to the right foot now. So right foot steps back, left foot is forward. We're going to start by hinging those hips back, and then we're going to drive the left knee forward so the belly comes more towards that right thigh. Starting at the foot, lots of weight in that big toe. Knee is stacked, slightly rotated in. We're going to think tuck underneath with that right hip. And then if you want to add in the reach, feel free. Just exploring the sensation here. We're trying to find a deep stretch in the glute, like deep glute, like if you're wearing jeans where you'd put your hands in your pocket. And then we're going to continue to check up and down that right leg. So lots of weight in that right big toe. Right knee is kind of twisting in. Belly is towards that right thigh. Slight tuck underneath. And just spending time here to feel the sensation so that we can find that same sensation in other movements. Let's go ahead and move on to that lateral hip shift. So we're only shifting to one side at a time. If you want to grab on to your weight, feel free. We're going to start going to the left side. So we're going to slightly hinge forward, so about halfway between upright and parallel. You're going to hold the weight in your right hand. So we're going to put a little bit more weight into that left foot, but think both big toes have weight in them. So we're not just flailing on that right foot. Go ahead and reach for that left foot and then exhale to come back up. So we're reaching for the left foot, lots of weight in the left big toe. Knee is generally stacked over the ankle, belly towards that thigh, and then come back up. If at any point the weight feels like a little bit too much, you can just place it down on the floor and just continue to move through it. Over time, the lower back will get stronger to where you can hold it for a longer period of time. The weight sometimes just helps you sink a little bit deeper into this hip shift, but still think lots of weight in the big toes. Let's switch to that right side now. Come back up. So So it's almost like a mini squat, lunge to the right side. We're not going super deep with it, but we really want to think about weights in both big toes. Knees stacked to the right leg as we shift, and belly comes more towards that thigh. So we have this twist in the upper body that is happening. In about 20 seconds, we're going to move towards the floor to finish up with that side plank reach. But this round, we're going to lift the hips off the floor. Let's go ahead and place that weight down. And let's come down to the floor again. You got about 30 seconds to get there, so no rush. We're going to stack the knees in the same way. I'm starting with my right elbow to the floor and right hip down. And then we're going to kind of elevate the hips up. So we still kind of have this like 90-degree position. And we're going to do that same reach and then come back, but we have the hips a little bit off the floor. If that feels too much, you can keep the hips down and just do the same variation. So go ahead and reach and then come back up. Reach, come back up. As you reach, the hips may sink back just a little, and then you come back up. So there's like a little bit of front to back movement with the hips. So we get a little bit more oblique action in here. Again, if you're like, this is a little bit too much, just keep the hips down on the floor and then reach with that. You could even do like a few reps down on the floor, a few reps up. Let's go ahead and switch to the other side. You have about 20 seconds to flip over. Left hip is down, left elbow is down. And now we're gonna slightly lift the hips. And then as you reach forward with that left arm, the hips are gonna sink back just a little. Go ahead and reach forward and then inhale, come back. So we have the rotation in the upper body that's helping to reinforce the rotation in the lower body. And the floor is keeping that left knee in its position. Let the rotation glide that right knee forward. So we find more of that closed hip position on the left. And that concludes today's strength workout. Thanks so much for working out with us today. I hope that this workout helps to bring a lot of relief to the pelvic girdle. You do not need to be in pain during pregnancy, and you certainly don't need to suffer through motherhood either. All of these exercises can help to improve how well you can shift your weight over to the left side to relieve a lot of the common discomfort that you may be feeling. If you want more support throughout your pregnancy, check out our online prenatal fitness programs where we give you daily workouts to feel strong and comfortable as you prepare for birth. In addition, our prenatal fitness programs help to prepare you for the postpartum. If you're postpartum, you can check out our online postpartum fitness programs, which include on-demand videos in addition to self-paced workouts so that we can meet you where you're at in motherhood. All of our fitness programs come with lifetime access, so you can grab them for your journey now or for future journeys. We've had clients that have come back and utilize our programs for multiple pregnancies and multiple postpartums, so your investment really does pay off. If you enjoyed this specific workout and you're wanting more workouts to help support pelvic stability specifically, check out our Pelvic Stability On Demand program, where this workout, in addition to so many more, are included to help you feel comfortable and pain-free as you navigate your motherhood journey. Check out all of our courses on our website at MamasteFit.com and use code YouTube10 to get 10% off any of our online offerings, and be sure to subscribe to our channel so you get notified whenever we release new workouts and videos.